I'm here with John Wright, former radio talk show host and political speechwriter and strategist.
So, Mr. Wright, why do you think Utah is not committed to an exact plan with the expansion of Medicare?
I think it's largely due to the hatred of President Obama here in our state. Most of Utahns consider themselves conservative Republicans, as does about 85% of our legislature, and so they are less likely to do anything that President Obama has passed or legislated, and Obamacare is one of them. So none of them want to do anything that President Obama is behind, and that is the reason for this delay. And we're not even sure if they're going to accept the Medicare expansion at all.
And this is all just because of a hatred towards our president, or
I think
because of what he would like to do with this going forward in this country?
Well, I think a lot of it is based on a lot of the ignorance to the actual issue. And by that I mean most people are unaware of what this expansion entails. And many people who this expansion would actually benefit are not for it, mainly because they identify as a conservative Republican. They dislike President Obama. So if it's Obamacare, they're against it. And so what the real key here is people need to understand what this expansion is, whom it will help, how much it will help, not just the people that get the coverage, but our state as a whole. And until they understand that, we're going to have a strong current of people against this expansion, and that's what we have right now.
So then, how many Utahns do you think will be affected by this expansion?
All Utahns are affected by this expansion, and I'll explain that. The people that are currently being considered for expansion to be covered under this Medicaid program, it would be those making up to 138% of the poverty level, which is very minimal amount. It's about $16,000. So any family making less than $16,000 a month would be covered under this expansion. Now, many people well under that number are already covered. So it's the people from well below this line up until this new line at 138% that are going to be covered. And those are the people directly affected, but all Utahns are affected. And I'll explain that. If these people aren't covered, they are being treated, and they're treated in our emergency rooms because no one under federal law can be turned away from an emergency room for care. So these people that have no coverage and no preventive care or any kind of doctor visits, whenever they get sick with the flu, the cold, or an injury or an accident, they go right to emergency rooms, which we all know is the most expensive form of medical care. So they're treated at these emergency rooms. They don't pay because they can't. And those costs are passed along to every Utahn through higher insurance premiums. And it's also passed to the general fund of the state of Utah when they go to University of Utah hospitals. So those bills are not going to be paid by the people that get the care. They're paid by the rest of Utahns. So Medicaid expansion affects us all. And that's why when the federal government that has already collected taxes and is already has the money for this program, they are just waiting with the money for us to accept it and expand. And we're getting a huge resistance from the Republicans here in Utah because they dislike President Obama and they don't want to expand government. But I find it ironic that all these people that don't want to give government health care to these people, all of them participate in government health care. They all get health care through the state of Utah because they are legislators and work in the state government. So they are asking us to deny the least of us out here, the ones that are struggling the most. They want to deny the very health coverage that they enjoy to others that are less fortunate than them. I find it actually, it's immoral, and that's why to not expand when it's already been paid for. Our taxes have already been withheld. The medical device tax has already hurt our local companies. The money is there. They just need to take the money and expand the program.
So how will this expansion affect Utah's economy in general?
If the state of Utah accepts the expansion or some form of it, even the governor's Healthy Utah plan is not ideal, but it's a lot better than what the task force on health reform that the legislature has proposed, which is comically bad. If the expansion is accepted in a large form, the effects on the economy can barely be quantified. We are talking about a whole segment of our society that are stronger, healthier, happier, and when people are healthy, people work. And when people work, they contribute to our economy. the economy expands, productivity expands, growth expands, and as an added benefit, healthcare costs for Utahns that already are insured through private plans, those stay stable, or even in a perfect world, they would go down, leaving more disposable income for everyday Utahns not affected directly by this coverage. They have more money to spend, more money to put into Utah's economy. So it affects every Utahn, it affects every American, and all it does is do good things. And again, the money is already there. It's already been taxed and taken from the state of Utah. It's sitting in the federal government's coffers. We just need to accept it and begin to spend it in a wise and prudent manner and help those people that need help. No one should be bankrupted by health. And that's what's happening. These people are poor, and health issues make them poorer. We need to help them get healthy and help them work harder and get more money and contribute to society, and everybody wins.
Is this as accessible as it sounds? I mean, you're making this sound like it'd be a fairy tale ending if all this went left and right correct.
You make a good point. It's not as simple as it should be, but it's better than it's ever been. All these people have to do is sign up for the expansion if it is offered. And there are services, there are charitable services and the homeless shelters and all those different people, all those different companies and corporations and charitable trusts that help these people. They are ready and willing to not just feed them, clothe them, and house them, but show them how to get signed up for this expansion, get them on a plan, get them covered, and get them healthy, happy, and working again. It's all ready for us to do. It's not going to be easy, but it's better than what's currently happening, which is you have people being bankrupted and dying in our current system, and our system is being rationed, and it's not a ration. It's not a fair ration. It is, if you can pay, you get well, and if you can't pay, you don't get well. And if you can't pay and they help you in an emergent situation, then you go bankrupt. It's not a good system. We have the best healthcare technology in the world, but we have one of the worst healthcare delivery systems in the world. This helps deliver healthcare to everybody better.
Thank you for your time, Mr. Wright. I really appreciate you coming and sitting down with me.
No problem. Nice to see you.